Welcome to day 2 of CES. This is Timothy Chen for Medidata. We are in the Dassault System booth talking about clinical research and the patient experience on the Medidata platform. Today we have a number of demos that we're showing the crowd here around what it looks like to be a patient using our software and participating in clinical trials. Right now we're going to show an app that's really interesting for patients to think about participating in trials remotely, be able to capture vital signs just with the power of the camera on their phone, tablet, or laptop at home. So our model here, Reina, is going to help us demonstrate the power of this app. What it's going to do is actually shine light from her face and use the underlying blood flow to analyze her quality of health and display some of those results in the app afterwards. Again, only 30 seconds. So Reina, we're going to have you start to move in a little bit closer.
By having Dassault Systems human virtual twins, they're able to really perfect, get it.
Okay, so in that short amount of time, we're able to gather enough data that we're going to show some basic vital signs, along with some interesting interpretation of those vital signs into other measures. So if we go over to here, we have a couple of different sections that we can display vitals with regards to heart rate, breathing, and blood pressure. So from that starting point, we're going to be able to see some other measures. If we go over to the physiological area, we can see heart rate variability and cardiac workload. We can also see some measures around mental stress. Reina is doing fantastic. She is not stressed at all. She's a pro at her job. If an individual has a more specific profile that they've set up for themselves, it'll be inputted with their specific height and weight. So here is just a reference on some of those measures without any of that extra demographic information. You'll also see some interpretation of general risk. So no risk at all for cardiovascular disease, heart attack, or stroke. And then very healthy metabolic risk factors here. These are related to hypertension and diabetes. We also have some measures, again, related to more of the blood sugar and diabetes areas in HbA1c and the risk of fasting blood glucose levels being too high. I think that's going to give us a very good overall score for Reina's health today. And again, the whole idea for this is to make it as easy as possible for patients to sign up and participate in trials. One of the biggest burdens in clinical trials worldwide is the burden that it places on the patients to have to travel to a physical site or a hospital. So what we're introducing here at Medidata is a series of tools that hopefully democratizes that access to trials and provides a more holistic picture of the patient, because they're going to be able to participate in a more continuous longitudinal fashion. So hopefully that explains some of the features that we have here in the technology that we're introducing. Thanks for participating.